So thank you for joining today's Lunch and Learn webinar on linking treatment plans into your notes. My name is October Boyles. I am the clinical director in ICANotes, and I'm going to show you how in ICANotes to link the treatment plans into your notes. This is a really important thing to do, and let me explain why. If you work inpatient or outpatient and any of the following organizations, if you're familiar with them and they are your regulatory agencies, such as the Joint Commission or CARF, they love to see treatment plans linked into the note. That way you're addressing the short-term goals and the interventions with that client and kind of working on the treatment plan as you go. Folks that are in private practice, they don't worry so much about treatment plans, but especially if you bill to CMS, so Medicare or Medicaid, they are going to want to see your treatment plans. A lot of folks have got audited and gotten in trouble because they didn't have treatment plans on the chart. So now it does take a couple minutes to create a treatment plan, but actually linking into the note takes no time at all. So I'm going to show you an example. I'm going to go into Piper Chapman's chart. I'll go into Piper's chart. I have a couple treatment plans on her. Some are complete, some are incomplete. To be able to see where a treatment plan is located, this is right here on the left-hand side. It's active problem needs list. It'll show you all the active treatment plans that are going on. So I'm going to go into a note. Now, I will take you through a bunch of different notes to show you exactly where the link to treatment plan button is. So first, we're going to go into the prescriber note. This is for prescribers. This is physicians, nursing assistant, or excuse me, nurse practitioners, and physician assistant. Screwed up the nurse and assistant there. So nurse practitioners, physician assistants, and providers, physicians. So there's a link to treatment plan button in their progress note. Okay, it's on PN part 1. So right there, link to treatment plan. A little different on the counseling therapist social worker note, the non-RX note. Link to treatment plan is kind of hidden right here, down at the bottom. Okay. Group therapy note. Scroll on down here. There's our link to treatment plan down here. Now, if you're doing group therapy and you're using group therapy notes and you have a group that is not just couples or family, you have a group of 3 to 4 people or 5 to 10 people, you don't want to use this group therapy note. You want to use our group therapy section shrub. We do have webinars on that. It's much easier. And we also have linked to treatment plans in those. We have a nursing progress note. Right in the nursing progress note, there's your link to treatment plan button. And then last but not least, we have one in play therapy as well. Link to treatment plan. Right down there on the bottom. All right, so that's the location and the notes, but I'm going to go back to the non-RX note. I'm going to say that this patient's doing great. I'm going to come down here and link to the treatment plan. So I just click link to treatment plan. All of the patient's treatment plans pop up here. So I can click on master treatment plan, and I've got 2 problems under that treatment plan. I can select depressed mood, and there are no interventions for depressed mood. That means that treatment plan is not complete. If I try to click on anxiety, it will say, hey, there's no interventions there. If you get that message, that just means that you started a treatment plan, you did the long-term goal, you did the short-term goal, but you did not complete the interventions. Okay, so that is considered an incomplete plan. I have the really depressed plan, and then I can come down here and select the problem depressed mood, and it will give me my short-term goals. Now, what I would encourage you is to pick 1 or 2 to link into your treatment plan. I wouldn't try to link 4 or 5. I have heard of an auditing agency coming back and saying there was no way that you could have gone through all these short-term goals and interventions during your counseling session. That's rare. That's the only time I've ever heard of that. But stay on the safe side. Generally, you're addressing 1 or 2 of the short-term goals. So you can come in, you can select all of them, or you can select none of them. If you're working with an interdisciplinary team, all the short-term goals will come up. That means the prescriber's short-term goals, where it says therapist counselor, it will identify prescriber, case manager, nurse, dietitian. That your discipline is what you need to pick. Okay. So, but since we're in a therapist note, I'm going to select a therapist short-term goal and intervention. So I'm going to just take the first one off the top. I'm going to go ahead and link that intervention in. And then what we always want to address when you're talking about treatment plans and how folks are doing, what's the progress and what are you going to do with the plan? So this is a short-term goal. What's the progress and what are we going to do with the plan? And we have those shrubs right down here for you on the progress on the left-hand side. I'm going to say this patient's doing really good, gives me a nice good statement. And I'm going to say we're going to continue the current plan because progress is seen. So we've got these here. Now I'm going to go ahead and go back. So it's 5 clicks total. And then I do need to put in a service code. You're not required to put in a service code probably, but I have billers working in the program right now, so they like to have that feature on. You won't see clinical decision support rules probably either. Those are settings that I have set up for MIPS and meaningful use. But what you will see is this note. And I apologize. My internet's running a little slow today. I'm in North Carolina. So we got hit a little hard, and it is just, I have power now, but there's a little bit of a delay as far as my internet. It's usually stellar, but not so much since the hurricane. All right. So there's my note. There's my progress note on this patient. I'm going to back out of it so you can see a little bit better. So I've got my interval history and my exam. I got all of that by just clicking the all normal button. My diagnosis is there, and there's the treatment plan is under your instructions, recommendation, and plan. Linking to treatment plan, the depressed mood gives you the problem, the long-term goal, the short-term goal, the intervention, and then it talks about the progress that we're meeting in those goals. Okay. Now, if you need your patient to sign their treatment plans or sign their notes, you simply need to initiate the point signature device. It's free with Icon Notes, but to do that, I simply hit the, I come down here, select patient. I hit capture signature, and I am simply using my mouse. Okay, so I'm using my mouse to sign. You can use a mouse. You can use a touchscreen tablet. You can use a touchscreen computer. And then we also have one Topaz signature pad that works with Icon Notes. We don't sell it at Icon Notes. We give you the actual number of that Topaz signature pad because there's lots of different Topaz signature pads out there. We give you that one. You hook it up. If you find it for eBay at $20, that's great. They normally range about $150. But multiple ways to sign. If you're thinking, well, I don't have this on my Icon Notes, all you have to do is call support and ask for the point signature device. That's it. So, all right. Now, if I go to view this PDF, not only do I have this nice note here, this really nice progress note with my treatment plan linked in. Also down at the bottom, I have medications listed in mine, but there is the patient signed it. All right. I'm going to go back through one more time. We're going to do this again. We're going to link a treatment plan in. I'm going to pick I have Shannon in here. We're going to pick a nursing note. Okay, so I'm going to go into a progress note nursing. I'm going to show you again. We're going to use that link to treatment plan button. Let's just say that the patient is normal. So behavior is normal and MSE is normal. And do link to treatment plan. Let's see if I can find something else. Anxiety. How about this treatment plan? All right. So let's just show. I'll go back to the treatment plan. I pick which one I want. I select the problem. And then I am going to select just one. So we're going to provide group feedback with focusing on organizing thoughts and behavior. We're going to go ahead and link that intervention in. I'm going to say that this time, this patient's not doing well, okay? Not doing well at all. The problem is worse. So I'm going to go ahead and click problem worse. And you're going to have those patients that you have given them the best short-term goal to work on and really great interventions, and they're just not going to do it. They're going to get worse, or there's not going to be any apparent movement in resolving those problems, and you can document that easily through Icon Notes. And so what I'm going to say with this patient is that we're going to continue the current plan because more time is needed. All right. So I've got that in there. We're going to go ahead and go back. Again, you won't have to compile a service code. I'm doing that because my billers have that set on. But I do need to compile this note. And then I'll show you exactly how the treatment plan looks in this note. So as you're moving through, it's 5 clicks to link the treatment plan into the note. And as you get better and faster, it's about 30 seconds. Okay. So well worth it if you are working with Medicare or Medicaid, especially. Well worth it if you're dealing with the Joint Commission or CARF. CARF is especially hard on treatment plans. So those organizations You really need to make sure that your treatment plans, not only do you have treatment plans on the chart, but you're charting to the treatment plans. So there is my substance abuse dependence treatment plan. There's my long-term goal, my short-term goal, my intervention, and my no progress. And my we're going to continue to work on that plan. All right. So that is how you link a treatment plan into the chart. We will always remember you want to electronically sign this note, and you can also capture the signature of the patient on the note. So you're able to do that. I do need to give you a warning, though. If you make any changes to the note and the patient's signature is on the note, it will go away. And the reason why is if you went to a car lot to buy a car and you signed a piece of paper, you wouldn't want them to change the contract with your signature still on it. Same with this note. If the patient signs something, you can't change it. You can change it. You can change it all day, but the signature will disappear. Okay. So, all righty. Any questions? Any questions at all? Do you like this? Does it look easy? Do you think you'll use it? Great. Great. That's wonderful. Thank you so much, Shannon. So that's great. All right. Thank you, Dave. Thank you, Shirley. Great. Great. Well, I definitely hope that this helps you in your documentation and makes things faster and easier for you, because that's what we want to do at iConnect is make you guys already have really hard jobs. I know I worked in mental health for 13 years as an RN, and it's everybody, you're out there trying to do the best for your patients, and there's very little time for documentation. So I hope this aids you in that. All right. You guys have a wonderful day. Thank you so much.